Hello, class. My name is Will Grafton, and the communication topic I focused on for this project is improving health literacy. Health literacy is the ability and understanding to make informed decisions regarding one's care. Also, it is important to note that those who possess adequate health literacy can navigate medical situations and use health information provided as a driver for their decision making process. Health literacy is important because it affords patients the ability to be empowered on their decisions that impact their care. If a patient possesses low health literacy, they may be impacted in a number of ways. They may not comprehend diagnoses, not understand the impact of lab results, or even simply comprehend when they should see a healthcare provider. Research I gathered throughout this assignment rigorously defended the point that poor health literacy is shown to negatively affect health outcomes in patients. Improving health literacy can build trust between patients and providers and also advance health equity, which is also important. Now that we have covered what health literacy is and why it is important, it is crucial that a viable solution is put forth to begin addressing this wide reaching concern. I'm proposing formal training for healthcare providers that will give them the tools and knowledge to properly address those patients who have complex needs. The robust training will offer techniques and strategies to relate to those patients who possess barriers that make rendering optimal care more difficult. To ensure flexibility, the delivery format will be online training that healthcare providers can access at their convenience. Specifically, I propose an electronic learning offering that is 15 minutes or less in length and will ultimately become part of the annual trainings the organization requires of their providers. There's several benefits to this proposed solution. First, these communication strategies will allow patients to feel more connected to their care and will work towards mitigating adverse health outcomes. Clear and concise care presented to patients in their preferred method of communication will strengthen the provider to patient bond and ultimately improve patient satisfaction. For the providers, the benefit they'll see an uptick in patients who are attending appointments proactively for routine maintenance instead of when they get sick or need to be seen urgently. By patients becoming more educated on their care, it will also work to reduce complicated conversations providers need to have and afford them more time to address other patient needs. Here's some of our stakeholders here. The three I identified were patients, providers, and healthcare administrators. Patients are the beneficiary to communication strategy geared towards gaining their engagement. The providers are those who will participate in training to afford them additional tools to engage those patients who possess difficulty in understanding even basic medical terminology. Healthcare administrators will be crucial for their overarching support of this initiative to better equip physicians with techniques to engage complicated patients. I anticipate that patients will react favorably with healthcare providers going the extra mile to ensure that information communicated is clear and concise. This will help patients better understand their course of care and any additional follow ups that may be needed. Providers will be better equipped with communication strategies for discussing care with those possessing low health literacy. Despite how positive this sounds, I do anticipate that there will be reluctance with stacking on additional training to take. Providers are very busy. There's all their offerings, their trainings, their certifications that need to be maintained. So it does stack an additional item onto that list. Healthcare administrators will need to be advocates for improving health literacy and send a clear message on the benefits of this initiative. I suspect that since healthier patients utilize less hospital resources, healthcare administrators would be supportive of this endeavor as long as the training is succinct and it is delivered at a low cost to the organization. As terms of cultural considerations, I had a couple here that I think are very important to note. Patients may not have internet or a means of communicating electronically. We need to accept that that can be okay in certain situations and support their needs based on their communication preferences. So, for example, if a patient prefers not to communicate electronically or through portal message or likewise, and they, enjoy, reviewing summaries at the end of their visit, on paper, we need to continue making that offering. That might be where they're comfortable. And again, that's in their best interest and also the organization's best interest to continue rendering consistent care. Another cultural consideration and also barrier that I've identified is transportation. I think transportation can be a factor in some situations, especially with those patients living in rural areas, because healthcare facilities may not be that close by. These are the references I use to support my position on a means of improving health literacy. I hope everyone enjoyed this presentation and came away with a better understanding of what health literacy is, and most importantly, why it matters. Thank you.